go ahead and start recording. Thank you. Welcome everyone to the May 26, 2020 local agency WIC Nutritionist meeting. This is a first for all of us. This is a Skype-only meeting. Diane and I are here in the Portland State Office building in our cubes, separated by great distance. And I think there's one or two other people here in the office. Otherwise, it's very quiet. And I really appreciate everyone joining during this time. I realize everyone is very busy with providing services in many different formats. And this today at our meeting for LAWN, it is WIC in the time of COVID-19, and we'll be having a chance to connect and hear of your experiences doing business very differently. For the first time in all of our lifetime, it just even entering the building is a different experience where there's clearly signs that can only be 2 per elevator, and just I'm introverted by nature, and then to have the elevator door open and someone comes in without a mask on, and it's like, what do I do? Step out? It's just it's a different environment. It takes my breath away. So we will be going through the next couple of hours, and what is on the agenda today is we will take more time than we do, just doing a roll call, and we really want to hear what your local agency experience of providing WIC services during this pandemic has been like. We have a few state updates, including some work that has kept many, if not all of us at the state agency very busy, as well as some local agency staff with helping to design the new data system that we're going through. And then our discussion topic for today, which is tangentially, it's related to the Sequest design, including the high-risk nutrition services and high-risk care plans. So today marks the 65th day of the governor's stay-at-home order, and in many areas of the state, you're navigating the waters of what does it look like to reopen and being in phase 1, approaching phase 2. Here in Multnomah County, we haven't even moved forward to be able to apply for consideration for phase 1. And we know that USDA has provided waivers, and those waivers have been extended, with the WIC clinics having the option to continue remote services. By doing so, it has provided flexibility. I'm seeing that some are having problems getting into the phone system. Definitely, if you're having any problems, try the 971 number as suggested by Debbie. It has more options going on that one. But keep typing in if you're having any problems. Diane's on the line as well to help with that. We want to let you know that the waiver has been extended to June 30th, and USDA does have the authority to extend waivers right up to September 30th. We wish that they had and just done one big swoop, but they have not done that. It just trusts that we will notify agencies as soon as possible when USDA guidance has been updated and released, and we will provide 30 days for all agencies to be able to switch over to the new way of operating. But we really want to provide the option to be able to have flexibility in extending remote services that works best for your community and what's happening in your community. So I'm just going to check. Seems like we're having some phone problems. If you're able to log in using the Skype option, please do. And that phone number for calling in that has multiple lines is 971-673-8888. And Ilan says that Nancy is having some difficulties getting in, going to get into Skype. Okay, thank you, everyone. So let's see how we're doing with everybody. And if you are having problems or if you're needing any assistance in technology while we go through it, as we do the roll call, please let us know any changes we can make on our part to make this experience better. But the roll call question today is really, we just want to hear from you. We want to hear how things are going and what has been the most surprising change in your work during this time. If there's been no surprises and it's just work as usual, just help letting us know what your agency's plan is to reopen, or any other news that you want to share with us during this time. This is a time to connect and just hear from across the state how everyone's doing. So I'm going to start to see if I'm going to start with Baker County, and is Mandy or anyone else from Baker on the call today? Benton County. Anyone from Benton County? Clackamas County?
Hi, this is Jill in Clackamas.
Hey, Jill.
Hi. So we are providing services, obviously remotely. We have our staff, they all have laptops and cell phones, and we are utilizing Prevention Pays. So our texting has really increased. And I think the most surprising change would be the time-consuming element of actually connecting with a client. When you pre-arrange via text to set up a video, we're also using Doxy for video conferencing or for the appointment, or we're doing phone. And when you set a pre-arranged time and you think, okay, great, we're connecting at 10 a.m., and then you reach out to them and they're not there. Mm-hmm. So that's been, I think, frustrating. And as far as reopening, Clackamas is, public health is closed through the rest of this week. We're planning to continue remote services in WIC through the end of June. We'd love to see that waiver extended. And beyond that, it's just so rapidly evolving that that's the most recent update that I have.
Thank you, Jill. Yeah. All right. Thank you. I'm capturing all of this and starting to gather some themes as we go through. So I really appreciate knowing what technology you're using, as well as time, whether it's time in clinic or time on the phone. Time is an element as we're doing this work. And if you get a chance, if you can type in Doxy into the chat, just in case others may not know about that, that might be a good resource to share. Is there anyone else from Clackamas? Shelley, Julie, or Kim?
I believe I'm the only one today.
All right. Well, thank you for representing Clackamas County, Jill. Clatsop County, Sarah.
Hi. So Clatsop hasn't actually closed its doors, but it is allowing people that have appointments to continue the option to come into the clinic. So whether it's either over the phone or in person, it's up to the participant. And what's been surprising, at least in April, I was surprised how many people still wanted to come into the clinic for their appointments. But then it was very different in May that hardly anyone was coming into the clinic.
Interesting. Okay. Mm-hmm. And what is the word for Clatsop? I've heard that they're going into phase 2 soon. Did I hear that correctly?
Well, they were approved for phase 1, and then there's the 21 days for that. So I haven't heard anything about how soon they'll be going into phase 2.
Okay, so we're in this phase for a while. Okay.
Yeah.
Thanks, Sarah. Any other news you want to share, Sarah?
Well, as of Friday, I am now a grandmother. So, given all this weirdness with COVID, I couldn't go to the hospital to see my daughter. There was only one person allowed, and that was her husband. So I'm okay with that. I have gotten to see the baby wearing a mask, but I did get to hold him. So that's my news. Very weird, strange COVID times.
Congratulations, Sarah.
Thanks. It's exciting. Yeah.
All right. Do we have anybody representing Columbia County today? Okay. Anybody for Coos? And Crook County.
Hi, this is Lauren from Crook.
Hi.
So I think the most surprising thing that I noticed was how well staff adapted to kind of the new technology and working virtually. I was pretty nervous about that when we first started, but it kind of seemed like it really just took us kind of a week, and then it was pretty smooth sailing from there. So that was kind of a nice relief.
Mm-hmm.
Let's see, we are in phase 1, and that's been a little bit crazy. And we are planning to work remotely all the way through June 30th. I also would like to see the waiver extended, but we'll just kind of roll with the punches.
All right. Thanks, Lauren. Hopefully the reservoir wasn't too crazy over the weekend.
Yes, I don't know about that. But we do have new cases, so we'll see.
Okay, thank you. Let's see. Do you have anybody from Curry County today? All right, how about Deschutes?
Hi, this is Laura at Deschutes. We are doing everything by phone, and then proofs and all of that, we are texting clients to get appointments set up. They are emailing proofs or mailing in proofs. So it happened really quickly and pretty stealthily for the staff, I think. Our doors are actually open as of about a week ago, but we're not scheduling anyone. Everyone is still working remotely, and the county's just kind of seeing how that goes. We have a walk-in once in a while. Someone comes in because maybe they didn't understand that their appointment was going to be on the phone, or they have a formula exchange and they prefer to just do it that way, but it's very brief, and we have lots of checkpoints on the way in and lots of plexiglass and masks and things like that. So we might have a client a day, but maybe even not that.
All right, excellent.
Yeah, the surprising thing is how much clients are talking. Everyone here says they have trouble getting people off the phone in 20 minutes because they're not as distracted by the kiddos and the screaming and the trying to keep them calm after a hemoglobin and things like that. They're actually providing nutrition ed way more than they have before. So the staff is kind of liking it.
That's excellent. Yeah, it's a good consideration. Thank you. And you have additional news in Deschutes County regarding, we didn't get a chance to have a formal long goodbye to Janet.
No, Janet has exited the building. She was here for 31 years. So I guess the one saving grace for us right now is it doesn't feel like she's gone yet because we're all separated. So I think we're going to have a little bit of a hard reentry when everybody's back in the office and we realize we are down one of our pillars. So got a very nice phone call from her, not this weekend, the weekend before. She called me on Sunday. She goes, "Do you have a time for a quick call?" And I said, "Sure." I figured she forgot something at work. And I asked her what was going on, and she said, "I just needed to hear your voice."
Oh.
Well, when you work with somebody for 15 plus years, it was very sweet. She really is
very special.
Our grandkids and enjoying outdoors. So she's doing wonderfully.
Wow, that's excellent. Thank you for the update.
Yes.
Do we have anyone else? Is Monica on by any chance?
Monica, I believe, is off today.
Okay, thank you. And how about Douglas County?
Can you hear me, Cheryl?
Oh, there you are, Valerie.
Oh,
yes.
okay.
Yeah.
I needed to hit the button. Okay. So this is Valerie in Douglas County. We are still remote. We're kind of half and half on some people prefer to come in and work in the office with the doors locked, and some people prefer to stay at home and work. But everything is done remotely with the clients. But we have some people here in case someone needs to do formula exchange or whatnot. and we're planning to be that way until June 30th.
All right, thank you. Okay. Grant, which is covered by Hallie. So Hallie and Malheur, Hallie and Grant. Okay. Lindsay G for Harney.
Hi, Cheryl. Yes, I'm here.
Good to hear your voice.
You as well.
How are things in Harney?
Well, I didn't get to go when I was scheduled to in April. I know that they're doing still telehealth visits, and so far so good. I haven't heard a whole lot from them other than an occasional phone call or email from Kelly. Novak is primarily doing WIC now. So yeah, I haven't heard any big questions or concerns at this point, but yes, still doing remote.
All right.
Yep.
Thanks for joining the call today.
Of course.
All right. Hood River, Jillian, is she?
Cheryl?
Yes.
Hi.
There's Hallie. Thank you. Yes, go ahead, Jamila. I see that now.
That was all I was going to say.
Okay, so thanks, Julia. Hallie from Malheur and Grant County. Grant is doing appointments over the phone. Malheur, I have been surprised at how many participants we have had a hard time in the past coming in, and they're able to get them on the phone now. So a whole new contact with our WIC participants this way. It's been amazing to see how flexible everyone is being, staff and participants. We are still planning on doing phone consultations through June and being flexible as the health department starts opening and accepting more appointments. Thank you, Hallie, and thank you, Jamila. Anytime that I miss something, I appreciate anyone just jumping in to say we've got a chat going on. Excellent, thanks. Let's see. Jill from Hood River or North Central. Okay. Jackson County.
Hi, it's Megan.
Hey.
Hey, Autumn's on the call as well. So let's see. We've been working from home since the order went in place, and we've been doing all certifications from home and appointments, high risk. And then we have our front desk staff working in office. So if people need cards or formula exchanges or whatnot. And then there hasn't been any plans as far as when we'll return back. So they haven't announced any transitioning for us, but it'll be a very thoughtful process.
Mm-hmm. Yeah, it sounds, from what I've heard, Jackson County has been very thoughtful through this whole process. Yeah.
Yeah, definitely.
As many counties have, it's been very impressive to see how Oregon is doing. Thank you, Megan. And Autumn, want to add anything to that?
I don't know if her mic was working.
Okay.
We were texting about this.
Okay. Yeah, let us know if there's anything that Autumn wants added in. Thank you.
Mm-hmm.
Let's see, Jefferson County, is Abby on the phone? Okay, moving on to Josephine. Who do we have?
Hi, it's Christine.
Hey, Christine. And I think we've got Sherry too,
yeah,
right?
I'm here.
Yeah. Okay.
So we are still in phase 1, and all of our doors are locked. We are doing all of our appointments over the phone. Some of my staff do prefer to work in the office, so Sherry's at the office. I have a front desk person working as well, so that we can get cards and formula exchanges, etc. done. But for the most part, everybody's working from home. And what else was I going to say? We have put in work orders for plexiglass coverings for the front desk. So we're thinking around June 5th It's not a set plan yet. We're still in talks, but we may be opening the door just sometimes so that we can still kind of stagger folks into the building. But it's our plan to still do everything remote as long as we have those waivers. So for sure until the end of June, we'll be doing everything remote.
All right, excellent. Thank you.
Sherry, did you want to add the stuff about the appointments?
Yeah, I'll add. And one of the things that's been nice is, like it's been stated before, just people seem really interested in talking and sharing what's new. And I hear a lot of change talk, so that's been good. And like trying to spend more time with their families and just focusing on positives. And everyone's very cooperative. And like some of the challenges I hear too with, the phone, you call them at the appointment time, but then they aren't expecting it for whatever reason, but then they call back and somehow it works. And so it's great show rate. So that was kind of surprising to me that we'd be able to like see almost everybody, see in parentheses. But yeah,
Exactly.
a lot of people are telling me when I poll them that they would like to continue like this. The phone is great for them, but there's a lot of people that live out in the sticks. They live very far out, and access to vehicles are challenging. So it looks like there's a possibility that we might be able to do more virtual in the future, which we hope for those folks.
And Sherry, you mentioned that you're hearing more change talk. Is the change talk happening more often, or what do you think contributes to hearing that more?
Well, initially, I feel like I was hearing it because they wanted, to learn how to cook, or they wanted to learn how to, meal prep, or they were changing their health. For some reason, they were making changes. And then it changed, it shifted like in the last couple of weeks. It's like, okay, I've had it up to here with virtual Zoom and all these things. So I think we've gone through phases. And so when I say I hear a lot of change talk, I would say that initially it was a lot more than it is now. Now it's like people are finding, you know what I mean, their new normal within this crisis. And so I don't know if I'm answering your question, but
no, that is, it's they were very motivated. Something happened abruptly that changed. Yeah. Thank you.
Yeah. It's been fun though. Like everyone said, it's like the nutrition education, like you hope to provide, they're asking for it. And they're like, please point me to the right direction. I need to, I want to cook. All these good things, but I'll stop talking. Sorry.
Oh no. Yeah. They're engaged and they want that assistance. So that's, it's that window of opportunity. That's excellent.
Yeah.
Thank you. Klamath, Sue? Oh, Sue emailed me. She is not able to join the call today, and she did have some feels about our discussion later on in documentation. So I'll pick that up and channel Sue when we get to that. How about Lake? Is Tara able to join? Okay. Who do we have from Lane County?
Hi, this is Heather from Lane County. Can you hear me?
Yeah, but it sounds like we have other Lane County staff too.
Yeah, Carly's here too.
Carly?
Heather and Carly?
Yep.
Yeah.
Oh, excellent. All right. Heather, why don't you go ahead and start?
Okay. Yeah, we're both at our own homes, so we're all still working remotely. And at first I thought it would be hard to get a hold of clients on the phone, that we'd be playing a lot of phone tag. But I have not found that. It seems like a lot of clients are actually waiting for the phone call and happy to do the appointment over the phone. So that was a pleasant surprise in having higher show rates. And clients are appreciative of the phone appointments. So I do see that might become a request moving forward, especially for clients in our out clinics. That seems to be really helpful. And then we'll be reopening slowly in June is last I heard, but for now we're all still working remotely.
Okay, thank you, Heather. Carly, what would you like to add?
Well, I've been experiencing a similar thing. It's been pretty nice having that good show rate and people picking up their phone, being able to talk to some people that might have had issues getting to the appointment otherwise. Found a lot of people, like Heather said, have been really thankful that we're doing the phone call, and yeah, that has been nice. It's been interesting to hear how people are adapting to the situation, and a lot of people are still pretty positive. Not everyone, but that's been really great to hear as well.
Mm-hmm. Excellent. Thank you. All right. Who do we have from Lincoln County?
Well, this is Vernita. I'm the nutrition consultant for Lincoln County, and I was wondering if Vicki was on the call now. I saw in the chat that she was having some phone issues.
Yeah, I saw. Yeah, I did see a message. I was going to circle back at the end and just see how she was doing.
But the reason I brought that up is that she's going to be working for Lincoln County. So she's the Inga Daschel, who had been Lincoln County's longtime dietitian, retired at the end of March. And Vicki is just starting, I think, this week to work with Lincoln County. So they're very excited to have her expertise there, and hopefully she can say more when
Wait, Vernita?
Do you mean Polk County?
No, Lincoln County. No, I meant Polk County.
I'm like, did Marcella leave and I didn't know, Vernita? No worries. But Lincoln County is all fine with RA and
Marcella's at Lincoln. I
okay.
Know that. But can I just say that Vicki did help out at Lincoln?
She did, yeah.
Before Marcella was hired, Vicki has been all over the place. And I see another message from her in the chat that she's getting an error message. Network issues have interrupted her presentation, and she is having trouble connecting. So anyway, I'm going to give a shout out to Vicki because she is going to be working for Polk, and she has worked for Lincoln. And I'm sorry, of course, I got those mixed up because I work with both of those agencies. My bad.
No,
I'm now going to put myself on mute, and I won't say another word.
No, that's fine. I know that Benton was wanting Vicki to work more hours too, so we're just gonna have Vicki all over the Mid Willamette Valley. So thank you, Vernita, for that. And Vicki, yes, yay, Vicki says Beth. And Jamila, let me know if I need to leave the call and rejoin, if I'm causing any problems as a presenter.
Cheryl, I think that one of the things you might want to keep an eye on is muting yourself when other people are talking. That seems to get things a little wonky. Just as a heads up.
The only problem, Jamila, with that is because I'm sharing my screen, the way that I'm set up here is I would have to leave the presentation to mute myself, which is a bit problem. I know it was me not having the correct adaptive cords to go monitor to monitor. So I am laptop to monitor to, it's my own technology issue. I mean, I can definitely jump out of the presentation.
I think it should be fine. Most of the time, if folks are getting that message, if they just jump off and rejoin, it should be okay.
Okay.
I apologize for interrupting.
Vicki said, I did leave and return. It didn't make a difference. Thanks for the hint. Message says to wait for the presenter to restart sharing. I cannot. Well, I can stop sharing and then reshare, I suppose. See if that makes a difference. What do you think, Jamila?
Give it a shot.
Okay. Let's see. And sharing my desktop, is that the best way to go? Skype experts?
Yeah, if you could.
Okay. 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 Yes.
I can see it.
Okay. Okay. All right. And Vicki, my heart goes out to you. It is so frustrating. And if you are able to call in separately, I can get the slides out to you as soon as possible. And I apologize, everyone. Usually I do that before the conference anyway, just for those joining by phone. If anybody is on the phone working remotely, wants to go into the shared drive under Lon and make a PDF and send it out, that would be wonderful. That was my bad. So
I can do that, Cheryl.
Okay, thank you, Diane.
All right.
Okay. Okay, let's see. We left off was Katie from Lynn County on the call? And Vernita, is there any changes in Lynn County you want that we should know about?
Okay, I'm just making sure I'm channeling the right agency now. Okay. Here's the big news. Katie's husband had taken a new job in Texas, and so Katie is going to be moving this summer to Texas.
Oh, so sorry.
And we're feeling really sad because she's going to be leaving. He's already had to go, but she's, going to be doing a little more business here, wrapping things up before she goes. And so, anyway, that's the news. I'm not sure what the timing is going to look like exactly, but eventually they're going to be looking for a new RD coordinator.
Okay, thank you. It is always surprising to me during this time that there are the changes happen. People are moving, so there's movement.
Yes, it was a good opportunity, I think, for him, and it just was. Yeah, one of those.
Kim McGee says, "Can Vicki work in Lynn County as well?" Okay. All right,
I'm pretty sure.
Oh dear, I'm not going to comment on that. That's asking a lot here. All right, so Marion County, do we have both Ilana and Nancy?
Yep, we're both here. Can you hear me okay?
Yeah, sounds great. Sounds like you're right next door.
Good. So we've been very fortunate. All our WIC staff has been working from home for almost 2 months now. And the good thing is that our caseload increased by almost 300 people. So it's 5% increase.
Yeah.
I'm very happy. But the problem with me is that I'm not able to provide the whole complete assessment without the height, the weight, hemoglobin, without me actually physically and visibly assess my client. So that makes it really tough for me. But, what can you do? This is the safest way to provide services. And so as far as opening, Marion County, of course, has the worst cases of COVID of all the states. So we're still under phase 1, I believe. I don't think the health department is open, but I could be wrong. I haven't been there for 2 months. And so we're just waiting to find out what our commissioner's decision will be. I know that we'll close, WIC staff will work from home until June, according to the waiver from the state. But I don't know what happened after that. So there are a lot of staff, quite a few staff who, they love working from home, and I can totally understand. So there are mixed feelings about working from home for some people and actually going back to the clinic when it's safer to do that. So,
Yeah, there has been a trade-off with doing business this way. That's definitely sure. And when you have a county that has either nursing homes or the prisons, that really impacts your caseload, the number of cases with COVID. So, yeah, thank you for that.
Of course, is that your desk, picture of your desk?
Well, that is a picture of one of our staffs. I won't, unless they want to disclose themselves. I we shared this at an all staff meeting, and that would be for that person to be able to share if she wanted to. But these are all
Very nice
pictures.
tip.
Yeah. Thank you. Thank you. Tiara says it's mine, but I'm at an actual desk in my downstairs now. So she's in the basement, probably commandeering the shared desk down there, needing 2 monitors. Yep. Thanks, Thierry. Is Nancy on the call from Marion?
Yes, I'm here.
Hey, Nancy.
Hello. So I feel like Ilan covered everything nicely.
Okay.
Yeah.
Excellent.
Yeah.
Any surprises for you?
Not really. It's been, I would say I'm getting a fair amount of people who aren't answering their phone lately, and it's really been frustrating, like the trying to call, and so we call a couple times, and then I'll text. We have the texting program, so I'll text a couple times and then call again, and then they'll call me 2 hours later when I'm talking to another client, and sometimes I can work them in, but that's been a little bit frustrating. But there have been some appointments that have worked out great, and some people who seem to want to get off the phone really quickly. So it's just kind of been a mixed experience.
Yeah, and you raise a good point. It'd be interesting to see if this continues on, if they are as willing to answer the phones. Yeah.
Yeah.
Yeah. All right. Thank you. And who do we have from Multnomah County today? Is Jan on the call?
I don't know that Janice. This is Mary Kay.
Oh, hi, Mary Kay.
I think there are others, though.
Lisa.
And Lisa?
Lisa.
Okay. Hey, Lisa.
Hi.
How are things from Multnomah County?
Well, I think lots of people have said it. It's been pretty crazy, but everybody's doing remote services. We do have the Gateway site available for pickups, kind of a once a week, except for the end of the month. We have several days this week where people can pick up an EWIC card, get a breast pump. But it's by arrangement. They call when they get here. We find out what they need. It's a quick run out, give them what they need, text them links for how to assemble their Lactina or whatever. So that's been kind of that's been kind of how we're doing things. I think we also saw a bump in caseload, show rates up significantly, but I think lots of folks have shared similar experiences that sometimes people aren't there when you call and call you back, but a lot of times people kind of are pretty creative about just going down their list of folks and then calling it back and catching people. So, and I can let the dietitians speak more to that.
Okay.
We are not opening anytime soon.
Okay.
We will probably be.
Yeah.
We will probably be. One of the last.
Well, we'll be the last. Yeah. And I see that Emma is having a hard time with her audio. And Lisa, how are any surprises for you?
Oh, surprises. I think in the beginning, it was just hard it seemed like a lot. And then as we adjusted of what we needed to do and how we did it, and you kind of got into the flow, things have gone more smoothly. And it is a hit and miss with calling. Sometimes they're right there. Sometimes you call all day, morning, afternoon, and you never get a hold of them. And then they call and say, hey, call me. So, and I agree with whoever mentioned it. It's hard to do the assessment sometimes when you don't have any measurements, or, their hemoglobin was low. And so sometimes assessment, well, most of the time assessment is difficult, but we're just being creative.
Yeah, excellent. Thank you. And Emma, I'm sorry, you're still having problems with audio. It's frustrating. And I believe did I miss anybody from Multnomah?
This is Roxanne. I'm
Oh,
still
hi,
doing
Roxanne.
on-call. Hi, I'm still doing on-call with Multnomah, so I've been still putting in some hours remotely. And it's been going pretty smooth for me for the most part. The clients have been answering the phone.
Good. Thank you. I didn't realize you were still on call with Multnomah. That's great, helping them out.
Yeah.
I think I haven't heard anybody else.
Yes. Hi, this is Liz. I'm also.
Oh, there you are, Liz.
Hi. So this is all new for me. I just started, so everything's pretty new to me. But so now this is kind of becoming my norm. Yeah.
So when we go back to going into the office, that'll be a whole new adjustment period. Yeah.
Yeah.
Yeah, there's nothing like getting a new job and then going, oh, okay, I'm going to work from home now. Yeah. Thanks, Liz. And as we go through, if there's any questions that is use an acronym or it needs clarifying, please either type in or speak up. I really appreciate having that feedback. Okay. I don't think I heard that North Central was on the phone unless they joined later, and I don't think we have Polk. So that brings us to finding out who do we have from Salud.
Hello, this is Lynette, and I know we have others on the meeting as well. From my perspective, just the rapid change and how we're doing business now has been a big change and surprising change. As far as reopening, we just had a team meeting today with our WIC supervisors in both Oregon and Washington State that work for our agency, and we're just really in the brainstorming phase right now to figure out what reopening might look like for us.
Okay, excellent. So we're still providing remote as long as you can, and I see that Elizabeth is on the phone, or is on as well. She typed in a message. And Greg, excellent. Okay.
And Dale was having trouble. Oh, there he is.
Yes, Dale?
Yeah, I'm here on the phone. I can't get any of the, I don't see any screens. I'm only on the phone today.
Okay. Okay. Well, one of the updates we'll have is we'll eventually be going over to Zoom because Skype will be going away. So we'll hopefully, maybe we'll have better luck with the different technology. But and is Amber joining? That's the only one left I have, I think, from.
I don't believe she's on the call.
Okay. All righty. We've got several state staff on the call. And I don't know if any state staff will go into the next question, believe it or not, besides just the warm-up questions we have here. And yes, it's 2:45. Would be just any questions you have from the state. And if there's any additional questions that the state has, we can wait till that next one and continue checking in with the local agencies, if that's okay. Okay. Yeah. Okay. Tillamook, is Erica on the call?
Yeah. Hi there.
Hey.
Yeah. So we are mostly working remotely. Our clerk is here in the office most days of the week, so that kind of helps things run smoothly. And there hasn't yet been talk of our reopening plan for the building here. Our county is in phase 1, of course, but our building, like the door is still locked to the public. So yeah, we're planning on phone visits at least through the end of June, and it has been going well, but I am noticing that show rates are kind of dropping off a little again. So I don't know what's going on with that, but people still, they seem to really like the phone visits to begin with. So we'll see what happens.
Okay, excellent. Okay, thank you. And CT Umatilla?
Hi, this is Elisa from CT Umatilla.
Oh, hi.
Hi. We last Monday went back into the clinic. We are not seeing patients at this time because Dusty, our RD, and I cannot do that social distancing. So we're not seeing people in the clinic. Working from home has been or was really good because when we all went on to lockdown, I didn't know I signed up to become a teacher involved in that. So I had kids home and but it worked out and we had a really good for some reason our clients would pick up their phone and we didn't have hardly anybody miss their appointments. It was great. What we have seen here lately is, I think, because people have been out of work, that probably they're not answering their phones, but they will text.
Okay.
So.
All right. Thank you for that update. It's good to have CTU on the call. Okay. How about Umatilla Head Start? Which is Jean Farmer's got a lot of territory here. She's got UMHS. If I have I might be off on my my roster here. Union and Wallowa, which is UMHS. Okay. And I don't see anything typed in. How about CT Warm Springs? Kathleen? Okay. And that brings us to Washington County. And I know we've got Richard. Is Tara also on the call?
Yes, this is Tara.
Right.
And I think we have Annie, Stephanie, and Roxanne also on the phone as well. So I think a lot has been said of the experience that we're going through. We've got about 50% of the staff in the office between the 3 clinics, and then we have about 50% that are at home and working remotely. So we do accept some walk-ins kind of on a appointment-like basis. Something that I'm surprised about is our ability to maintain separation of duties. We have a pretty good process in place to where we are able to keep that list short of infractions to separation of duties, so I'm pretty proud of that. And then the other dietitians can kind of chime in about their experience with the phone visits.
Okay, thanks, Tara. And thanks. Others might be wanting to know some good hints on the separation of duties, so we might be circling back to you on that one. So thank you. Anyone else? Richard, Annie, Stephanie, Roxanne? Roxanne, we're getting you in both counties here.
I'd like to say I was surprised at the number of my clients that are doing gardening right now. I've had some really nice conversations about starting home gardens and container gardening. So that's been really nice, and just getting their kids involved in the growing and the picking and the trying the fruits and veggies fresh out of the garden.
That's excellent. Thank you. A lot more. I'm seeing more searches of victory gardens going on and learning about those. So yeah, thank you.
Hi, this is Annie. So yeah, I've been at home, which has been fun, and I've noticed. Well, there's the downside of not doing the assessment with the weights being super accurate. It kind of makes me not hyper focus so much on weight and more on other things that we could be talking about. Like, how do you feel the meal times are going? People are doing a lot more homemade food and sitting down as a family, and they're kind of more together. So it's kind of changed some of the conversations, and kind of and there's some good sides to it. And then also with people breastfeeding, people who maybe were going to go back to work are now actually at home nursing, and so I think some of the conversations have been different as a result, but not all bad.
Yeah, excellent. Thank you for that perspective. Stephanie or Richard?
Hi, this is Stephanie. I feel like a lot of the logistics about surprising changes have come up already.
add that I'm surprised at how much I miss seeing children. I have a little one at home, but I will get a little teared up when I hear a baby crying on the phone. Like that feeds my soul at the part of this job. And so it's been an interesting switch and dynamic to just be on the phone and just miss that human contact with the little ones especially. So
Excellent.
And this is Richard. This has already been said, but I did notice that there was a huge increase in people who were picking up the phone at first, but now it seems like it's kind of goes in waves. It's up and down. I don't know if people are just tired of being on the phone and phone appointments all the time or what, but it seems like there's more hit or miss days now.
Yeah, thank you. Yeah, excellent part of it, both the challenge, the part of getting a hold of people, but then people are motivated to be on the phone, that there is that opportunity and to learn new things. And everyone, what I've heard resoundingly, and I've as talked with my counties, is how adaptable and resilient our work staff has been. So I really want to thank you. And I know that as dietitians, for some of us, it's really hard not having all that objective data in front of us. I did really appreciate what Andy was saying, is that sometimes it allows you to focus on behaviors and attitudes rather than just on hard data. So that has been a nice surprise. And I'm wondering, and I'm deducing as well, and this is where state staff will come in, and I know we've got some questions, but just knowing how long these waivers can go, and I'm hoping that, Tiari, if I'm saying this correctly, that we will always provide 30 days for those agencies to ramp up depending on when we hear. So that does put us out into the future. Is my math correct, or is that fuzzy math, Tiari?
So we are dealing with kind of a fuzzy information from FNS, and it's not the Western region, it's from even higher up. So all I know is that we have through June 30th, but we have decided that we will make the commitment to local agencies that you guys will at least have 30-day notice. So regardless of how much notice FNS gives us, we will take the brunt for that 30 days. So you will at least have 30 days notice regardless of how long the waivers go. Does that make sense?
So that means that they have through July if the current one goes through the end of June.
It means whenever we will give them 30 days.
Yeah. Okay.
So it may not be July 30th, but they will get a 30-day notice when. So say we found out that May 15th they weren't going to extend the waivers. We would let everybody know from then, and we would, even though it only went to June, say they let us know May 15th that it went through June 30th. That only gives us 2 weeks notice, but we would give through June 15th. That gives 30 days notice.
Yeah.
And then the state will take the brunt of that.
Okay. Thank you. What other questions do you have regarding WIC services for the next 3 to 6 months? And as we go through the next couple slides, it gives you a little bit more to think about it. I just want to capture anything right up front.
This is Sherry from Josephine County. I just have a question about the medical documentation forms. If those will be also updated, if we've been given any lenience beyond July 31st?
We were given a waiver for everything that we asked for through June 30th. That does include the medical documentation forms. It's not looking very likely that we'll be able to get the medical documentations forms much further. We may be asked to prioritize, and what we would prioritize first is the physical presence exception. So at this point, we have until June 30th on the medical documentation forms. If we are able to get an extension, like I said, we are pushing and NWA is pushing for them to just extend it everything until September 30th. It's not looking like they're willing to do that. And so right now we're going month by month, but we do have the medical documentation form through June 30th. So I know that's not the greatest answer, but that's unfortunately all I know at this time.
Thank you.
Hey, this is Christine. Thierry, do you know the reason as to why they're not wanting to do it till September and they're just doing it month by month?
There's some suspect that it's political, so, but I don't know the reason. It doesn't quite make sense because how we're doing services is currently working, and why we would want to bring a vulnerable population in when we don't have to. You know, there are some services that can't be done remotely, and we're able to do it remotely. So, and I say this on every single phone call I'm on, but like I said, a lot of the people I'm on with agree with this. This is higher up than Western region. It's higher up, even probably than USD or than the WIC headquarters. So I don't have an answer. There's some speculation that it's political, that we don't want to delay this opening because it looks, you know, it goes against what people are wanting to see, the country opening back up. So
Lynetta asked, does this also include the modification of requirements for two-way communication when a participant has missed their appointment through June 30th as well?
So for that one, and there's information coming out on the situation update, that one is one that we did not get a waiver for, so we are currently out of compliance. So we're going to allow that exception one more time, but that'll be the last month that we're able to do that exception. So for these ones, yes, but this will be the last time for that exception because we didn't ask for an exception for that one. We were mainly offering that one to allow as people got kind of scrambled to get remote services in place. So that one, because we are currently acting out of compliance, this will probably be the last month for that one.
So Ilan wants to clarify, is that exception through June 30th or May 31st?
For the no contact one,
yeah.
Or for the other? Yeah, it would be for those who, I have to think about that.
It's through this month. It's through this month. Right. Because
it's through this month for those who would miss.
At the end of this month.
I'm sorry, I couldn't hear each other. I guess I'm hearing that it's May 31st.
It's those who would have missed May's appointment or April's, and then therefore wouldn't have vouchers for either May or June. So yes, it is through June or May 31st.
Okay. And Kim does include a link in the chat of compiled guidance, which is on the WIC coordinator's web page, and it goes out with the situation updates. And one will be going out. So Ilan says, okay, thank you, May 31st.
And I know we've been talking about also the 19-calorie formulas, and I've been fighting, and we're not going to get anywhere with that one. Hopefully they'll just change the formulation soon, and then we just won't need the medical documentation. But NWA took it all the way up to the American Academy of Pediatrics to push Congress to do something, but I think we've hit a dead end on that one. So unfortunately, we still do need the MDF on those ones until Abbott changes their formulation.
Which they have not given us an updated timeline on that. So, and Ilan says, thank you for trying. The verbal order MDF really helps for Marion County. So thank you. So as we're going through, please either speak up or you can type in your questions. Some of the questions that we've heard is what changes can remain. So Thierry has spoken to the waivers, and those are specific to like physical presence and the medical documentation forms. There have been some changes that we have made to the food package regarding like canned fruits and vegetables, and some of those changes are a state choice, and those changes can remain. Did I hear someone speak coming in with a question? Okay.
Cheryl, this is Karen, and there's a couple of those changes. For example, the string cheese and the different milk fat content, those are actually part of the waiver that we got from USDA. So
those will not be staying.
More to come on how those will be handled.
Those are not state options, but whether or not we had canned fruits and vegetables on the food list, that was ours. Is there anything else that was our choice, Karen, that you can anticipate that they might remain?
Well, we're considering the canned fruits and vegetables, the eggs, and the 8-ounce cheese are the things that the state worked on, and so we'll be looking at that and considering whether or not we want to make those permanent or not.
So Karen, if there were dietitians that had a feeling about that one way or another, what's the best way to proceed on that? Just emailing you?
Sure.
Okay. So that was Karen Benton, or you can go directly to to your assigned nutrition consultant as well. So earlier I did hear that the several modifications are already being made in the clinic, whether it's the plexiglass going up or masks that are being distributed. So I would imagine that for all of us, this is flexibility is going to be the key component of just knowing how we will move forward until a vaccine is in place, and we have more assurance of being able to help work through any flare-ups that we might see across the state. We have put the local agency review process on hold. Polk County was the last one before we entered into the quarantine period. We are looking at starting up in the summer again in August, but that will all be kind of dependent on how things are, but that's what we're hoping. And then we're being flexible of just revisiting with the agencies to see how things are progressing. And we are figuring out at the state level as well. By no means do I want to be looking at chart reviews that necessarily focus right in on this period of quarantine. As a reviewer, I'd be going back further back into the 2-year period just to get a sense of how those charts are looking when the clinic was up and operating under normal procedures. So I want to reassure you that during this period, there's not we are going in with positive intent and not a got you perspective. These are unusual circumstances that hopefully will not happen again in our lifetime, but we recognize that we need to be flexible. And let's see, there's some questions that had come through. The fruit and veggie benefit, can they purchase the small cups that come in a pack of 4? And Karen says, yes, any container. So good question on that. And there will be impacts on training. Already we're doing our twist training on a monthly basis. Kim McGee has and Beth Lanham have championed taking this to the next level, and we will probably continue twist training in that format for quite some time. So that is being done by Skype. We know that Skype will be going away. Some counties have, I think it's called Teams or Meetings. It's the Microsoft version. It sounds like the state is heading towards Zoom. And So that training will look differently. It'll be much more virtual probably going forward. There's some things that this will be the new way of doing business. To be honest with you, the next one I have on there is hosting dietetic interns, and we can set up a call for those agencies that are preceptors. But from what I understand, I believe there's a nutrition, the Council of Oregon meeting that the dietetic program is proceeding of having dietetic interns. So it's kind of like, how do we handle that in the fall? So lots to be considered and to be thinking about. And that will be a follow-up on my part, is to schedule the agencies that are preceptors for dietetic interns. What other questions do we have? Oh boy. Christine asks, if you're planning on looking back at charts before the situation, how will you factor in any cap changes that have been made since then? So two different issues I think, if I understand your question. So there's that part of being reviewed and reviewing charts when we're working in normal conditions. And then the cap changes, if you're right, I see what you're saying, Christine, is if there are any corrective actions needed, what will that look like? And even several of us have agencies that are in a corrective action period. And we are having to have that discussion of, can we close it? How do we do that when we can't do observations? So there will be some that will just have to be open longer, and we'll have to figure this out. But it is a conversation that we're having at the state agency level as well.
Can I expand on that, Cheryl?
Oh, you betcha.
So sorry if you can hear my vacuum cleaner.
No, you're good. You're good.
I was going to say, so our cap is closed. But if we're going back, then some of those charts may not be in compliance because they were corrected after the fact, if that makes sense. So when you're going through looking at some of that historical data, changes have been made, and then current charts are up to date. So I just wondered how that would factor in, because I don't want to have a finding of a previous finding that's already being corrected, if that makes sense.
I believe so. And I would encourage everyone to document carefully that it is in a COVID period. And I think when we look at the charts, we'd also know when it's in a COVID period. So I think we would take that into consideration. Any other reviewers want to comment on that, Christine's question?
I'm not a reviewer, but this is Tiare. We're gonna, the reviewers are gonna look and they're gonna see, okay, well, they're gonna try to find the largest number of charts that demonstrates compliance. So they may look forward, they may look back, depending on the situation. But we wouldn't be pulling from charts that happened during COVID and then be citing for things that took place because of COVID. Does that make sense? Like Cheryl said, we're going to be going through this with positive intent, and they will be searching for documentation that it has been done correctly. Does that answer your question, Christine?
Yeah, I think so. I think my main concern was that, maybe that piece where Cheryl mentioned, well, maybe, 2 years back. And I'm like, no, don't look at those charts.
Well, our period, when we review, that's the period that, like right now, we're in the 20. Oh gosh, I'm always going to get stuck on this one too because it's a math problem. But we're in the 2021 review cycle. I'm looking at charts that happen in. Help me out, you guys. 2019.
That makes sense. Then.
Yeah.
Yeah. No, that's.
Thank you.
And I think what Christine is it seems to me like what there would need to be would be communication between the agency and the reviewer. So as the reviewer starts communicating with the agency, that would certainly be information that you could share. That would be to say, if you're looking at charts prior to this date, this is when our cap went into place. And so I would hope that what you would be seeing is a change after this training went into place or something. But that would certainly just like any time during the LA review process, I would assume there'd want to be real clear communication between the reviewer
Mm-hmm.
and
Yep.
what they're expecting to see and the
Yep.
agency coordinator.
That's a good clarification. Yeah.
Yeah,
Yep.
that's what I expected. Yeah.
Yep. So, state updates, we'll go through these, and then we'll, as much, because I'm not going to cut short the questions, so we'll get to what we get to, and the conversation about documentation will be one that we'll get to, and then we might need to follow up. So we'll start with risk update. Just know there's one coming out. Vernita hasn't got it done, and it will has a deadline clear into October, so she has lots of time. Vernita, when is it going to get posted?
Yes, it's going to be posted by June 1st, and it has been designed to be done individually, and it should take about 30 minutes if all the activities were done. It's basically just a PowerPoint with some links to updated risk information sheets, and then it has some information about risk documentation also. So it's fairly short. This isn't one that's really in-depth. And I wanted to include it in today's meeting just as a heads up to nutritionists, not that you are facilitating this training, but simply that you may be used as a resource. There may be questions that come up that would end up coming your way. So just wanted to mention that it's coming out June 1st, and it will be needing to be completed by October 1st, so plenty of time. And I picked the brightest template I could possibly find to help everyone stay awake, because it's risk update. So there's that.
Oh, Kim McGee corrected me. Completed by 9:30. I guess. For some reason I saw on your slides 10:1, but okay.
That's the way that USDA says must be completed by 10:1.
Okay.
And so that's why I put 10:1, because that's what they say, by 10:1. And so
the changes have to be implemented by 10:1. So if you're going to train staff in time for them to be implemented, that's why I put in 9:30.
Okay.
And fortunately, none of these changes are huge. Mostly it's just in definition. There's one title change. And it's more, I think of this as an opportunity to remind staff about the importance of full assessment and good documentation, and that the risk piece is a part of the eligibility criteria. And it's more, I'm thinking of it more along those lines, just as a little puff as far as risk goes. There isn't anything dramatic that's going to happen between September 30th and October 1st, but it is a requirement by USDA that we offer you this information, and so we will follow suit and make sure we're in compliance.
Thank you, Vernita.
You are most welcome.
So the next slide I have up is regarding the WIC Nutritionist page. This is a new page that is you'll find on the going to WIC staff and then over to where it says coordinators, training supervisors, and nutritionists. So it's a page where the lawn, what we had there, will be embedded into this, and it includes resources for orientation, roles and tasks, high-risk related resources. It is a dynamic and still under construction, and any feedback is welcome. So please take a look when you have a chance. And some of you may have heard, we are celebrating TRA taking Sue Woodbury's role as the WIC director, and that leaves her position as the nutrition and local services manager as an open position. And we are really hoping that all local WIC dietitians who have lots of experience has a chance to consider this. And I wanted to provide you with this overwhelming org chart, just so that you can see what that our team is. It is a lively and dynamic team. Across the top, you've got WIC. The WIC state office is actually a very large team that comprises of vendor management, data services, the nutrition local services, as well as evaluation, and our business and administrative services. And the one that is approximately 16 members strong is comprised of nutrition consultants, health educators, and our support staff. And we are a very wonderful team, and we're hoping that if you're interested, that you will be patient and navigate Workday to apply for that position. And there's a link there as well as the contact information. This was sent out broadly by TRA and shared with several professional groups as well. And if you're on LinkedIn or Indeed, it has popped up. So what questions, if any, of the state updates so far do you have? Do you know that coming in the next 5 to 7 years, there will be positions opening? It has been for decades that there haven't been positions at the state office, but this is a opportune time to be considering what that might look like. And if you're interested, just reach out to any of us for this particular position that's open now. And I can't remember when it closes. Ilan says, looking at the new,
It closes on May 31st.
May 31st. Thank you, TRA. May 31st it closes. That is, oh my goodness, coming up. So, Ilan asked a question regarding on the WIC nutritionist site is to have a link for the base camp. Thank you for that. I didn't put that up. Our webmaster did ask me if we wanted to have that because it is kind of a private private access. I don't know. I felt like maybe going to the nutrition consultant about that. Ilan says, I miss not having my cheat sheet for formula concentration since working from home. So not so much posting on the WIC RD page, we're just sending out to everybody on the long list group of how to get into base camp. We could definitely do that.
So, Ilan, are you looking for how to get into base camp or the cheat sheet for formula concentration?
Well, the formula concentration is on base camp.
Oh, got it.
Yeah,
So she's...
Yes,
yeah.
I would like to have a link because I have really, I can remember most of it, like the 22, 24 calories. But when you get up to 26, 27, I can't remember those. And I have difficulties accessing. And when I call the dietitians at Abbott or Meet Johnson, and they say, well, you just have to go through your sales rep. And I said, I don't see sales rep.
Yeah.
And so I think because of this, if we can make things a little bit easier, that would be really appreciated. If we have a link for that, or I guess I can drive to my office and grab that.
Ilan, actually, anytime that you get updates from Basecamp, if you click on that link from Basecamp for the updates, it'll take you right there. And then that is on the LAN webpage. If you're having any problems, we could definitely link out, but that's how I get into Basecamp more easily is if I get those updates, I just click on the Basecamp and it takes me to that page. And I'm not feeling comfortable posting concentration formula on a public website. We will keep that back behind the scenes in Basecamp. And that information came from the pediatric practice group of AND. So Jamila just sent a link, and we can also send it out to all of Lon, just so that everybody has that as you're working remotely. Yeah, okay. Thank you. Oregon has this. We're moving into our data system. Sequest is the company that won the award for the contract. So we're moving from Twist into a web-based platform, and we have had representation from dietitians. And if I have forgotten anyone, please, my apologies. But Ricky from Multnomah, Elizabeth Still and Lynetta from Salud, Richard from Washington County, Laura from Deschutes, Lynette, and then Valerie from Douglas. And these individuals have sat many, many hours, full days, listening to lots of different parts of the Sequest design. And I was wanting to see if there's any part really specifically to the high-risk services that any of those subject matter experts would like to comment on. Yes, Christine, I knew there was someone else. I'm so sorry, Christine. I will correct that. Yes. I felt like there was it wasn't complete, and I didn't know if I was missing Tara, but yes, definitely Christine from Josephine. You've been, yes. Okay, well, we'll move on to talk about a little bit more about Sequest, and hopefully this is the timeline. I had it verified by our project manager, Kim Word. So we're looking at still a 1 to 2 year project. There is lots of system development that is to be built in. And just as a reminder, this is a program that is what we call purchased off the shelf, that there are additional funding that Oregon has been put into for them to make some changes specific to requirements that Oregon needs. An example of that would be regarding scheduling. It would be including a section on the breast pumps. Help me out, team. What other parts are big ticket items that Oregon's being developed?
Beth,
I heard your voice.
Farmer market.
Farmers market, thank you. And Bonnie?
Yeah.
And Bonnie?
I just said the diet questionnaires.
Yeah, that's good. The diet and health questionnaires are a big component. Many states have had paper questionnaires. So Vernita is the lead on helping to help inform that process, and that is probably one area that we will be coming back to the dietitians time and time again to get some input on that. Mary, did you have one to add? I thought I heard your voice. Okay.
It was actually me, Cheryl, and,
okay.
And it was and I had said the assessment area. Yeah.
Okay, the diet and health questionnaire. Yes. Yeah.
And there's a comment in the chat.
Oh, thank you. Yeah, Valerie, definitely the nutrition assessment questions. That's that combined health and diet component to it. And Ilan said, I'm so glad local agencies, dietitians get to have input. Thank you. Oh, so valuable. It's so very important to have that input. And as we're wanting to include Lon in the discussion as much as possible. And the next part with the system, we'll be able to name it, because of course that's what we do with we name systems. And Liz, I don't know if you remember from TWIST training that TWIST stands for the WIC Information System Tracking. Did I get it right, everybody? Information Systems Tracking?
Yes.
Okay.
Tracker.
Tracker. Thank you. How could I forget that? Tracker.
Like Trekker.
Julie Reeder, is that you?
Of course it's me.
You're welcome. Excellent. I apologize. I didn't ask who else was on the call. My bad. And then there will be much testing and refining the new system. And then there will be a pilot period. And of course, we will do training and then a statewide rollout. So Kim Word said that I could share that we're hoping for December of 2021. But we be realistic, and I guess it depends on how much we have negotiations to do about how we want the system to look. Any questions about that? It is exciting. TWIST is getting very fragile. And it's kind of like you almost know that TWIST knows that there's change coming. Some days is very finicky.
Can I add something, Cheryl?
Yeah, of course.
Yeah, the part that I think has been interesting about this buying something off the shelf compared to what we've gotten in the past where we built TWIST or we built the EWIC part. There's going to be some parts that are fabulous. There's going to be some parts that are going to be a real change for us. I think that what I was surprised at, though, is we have never bought something off the shelf and had to change it before. So we're figuring out that process. So for instance, these design sessions that we've had, we didn't dive deep into it in some places. We were just kind of looking at the first set. So one of the things, or the first layer, I guess you'd say. So one of the things that we're really hoping is that as we go forward and we have to delve into some of these a little deeper, that we'll be able to, say, broaden the group out and have more input from more of you, because we weren't sure exactly how that was going to work. And luckily, it looks like they're going to give us some time to actually gather input, because they're not used to the way Oregon does it, where Oregon actually talks to the local agencies and wants to know what works best for them. So they've been amenable to that process at Sequest. So we'll keep asking.
Thank you for that, Kim. I was unaware of how talented and dedicated our programmers here in Oregon were to develop a system like TWIST that is as complicated. We may not like it. Some parts of it is not intuitive at all, but the depth and complexity, especially around modifying food packages and scheduling, is I was not on the group, Beth was, to look at the systems across the state, but there are not systems that you can just modify off the shelf that are the caliber that TWIST is. So it may be an old lady or that's a terrible term. I didn't want to say that. It may be aging and having some problems with the functionality, but that's more of the platform of maintaining it and not with the coding itself. Our programmers are amazing. So with a new data system, we have an opportunity to do some process improvements. And I'm sure we have lots of improvements we'd like to see in high-risk services. In fact, I have a note from 2015 that there was a wish list that came from Crick County. Credit goes to Mary for this question, is when the TWIST upgrades for medical documentation come, we want a code for a report that notifies expiration dates of the medical documentation forms. Well, the good news with the medical documentation forms is that they will have that notification on one screen as well as the forms will be able to be scanned in. So I know this question is a hard one to ask because we haven't seen the screens. Vernita and I kind of talked it over whether if it's time to show some screens, and I feel like it's just too early. But where we would like to look at have the conversation is a little bit higher level, and look at how the role of the dietitian working in WIC has changed over the 2 decades, and how that can help inform the system we help to create. Previously, and many of you have been here with WIC, where dietitians did not need to be certifiers. They only saw follow-up appointments, and that we had a much higher rate of declinations for RD services. Currently, we have the role of the dietitian is clearly defined as managing the high-risk caseload. You are required to be a certifier, and that all high-risk participant records must be reviewed by dietitians, and that there's a higher emphasis placed on high-risk services during local agency reviews. There's a yin and yang with that, but as part of it, the quality of nutrition services provided by Oregon WIC has evolved over time and continues to evolve. So in looking at what we have regarding data and high-risk services, that we know that high-risk services is a consistent compliance finding in local agency reviews based on 2018 and 2019 data, showing that 42% of the agencies did not consistently refer to the dietitian, and 33% of our agencies did not follow their local agency policy for high-risk management. So consistently, what we're looking at is when we do chart reviews, we're wanting to have 80% or greater that those referrals were being made. And how this looks over time is when we're looking at are the high-risk participants referred to the WIC nutritionists. Going back clear to 2015, it's changed a little bit over time, but it is about a third or more. The agencies are not getting the referral to the WIC nutritionists. And we know that some things that we're not comparing, as Julie would say, we're probably not comparing the same things because we have had change in certification periods. There have been other variables that have changed, but we know that that is still something that we are really working on to help support, is that the high-risk participants who are needing that are referred and seen by the dietitian. And then we did add a question in this past review period are the required components of high-risk care plans included as per policy? And of the agencies reviewed, 24% of the agencies did not have the required components of the high-risk care plan included. So what is required by policy? And this is kind of getting into as we move forward into the nutrition care process. But right now, according to policy 840, an individual care plan is a universal term. So it's a individual care plan or high-risk care plan at a minimum needs to include progress made in resolving nutritional risk, any nutrition-focused education or counseling provided, the identification of participant behavior change whenever possible, and the plan for future intervention that addresses nutritional risks. Then we have 9.5, and it says the RDN, the WIC nutritionist, may format the individual care plan however he or she deems appropriate. So we've kind of left this opening. And the question has come up as why? Why have we kind of had that be a little bit open, and why we haven't adopted one documentation style? And before I do that, is there any questions regarding the data that I shared before we move on? Okay. Oregon WIC is unique, and some of you have worked in WIC in other states. We have a more of a paraprofessional model. So there's paraprofessionals that may have a nutrition background, and there are paraprofessionals that have so there's professional certifiers that have a professional background like in nutrition, health education, and then there are paraprofessional certifiers that may have not had any nutrition information or training prior to working into WIC, which is, there are some real benefits from having individuals working in the community that they come from, and then we've got an up training going on of certifiers. But know that Oregon WIC does have a greater percentage of paraprofessional certifiers, and for a reason, then our emphasis has been on clear communication, free of jargon and acronyms. So if you look at some clinical chart notes, they're really heavy on acronyms and kind of. Sometimes I look at them and like, where's the plain language? So we really wanted to recognize that our communication in WIC is a communication tool between the dietitian, who's the expert in nutrition, being able to communicate that to all staff who might look at that chart. And we knew that a lot of documentation styles that are out there are deficit-based and with a clinical focus. Whereas WIC is participant-centered and focused on strengths. And the other reason that we have stayed with what we have is that twist, like a lot of programs, even new ones coming out, they're designed on the SOAP format, the subjective, objective, assessment, and plan. So how we stay, do we want to stay with that? That is that part of kind of like what works best for us. And we recognize that we are still evolving with our philosophy of RD services, and we want this change to be driven by you. We want to know what works for you, for your agency, working with your participants. At the same time, we know that a lot of you have dietetic interns, and they are learning a different style than what we are using. So when we start to look at what's appropriate documentation, this is where the nutrition care process comes in. And I want to, given the time, I mean, some of us are familiar with this, some of us attend training on this, but essentially it's the nutrition care process was developed by our own association, the American Dietetic Association, in 2003, with the House of Delegates approving the nutrition care process in order to provide registered dietitians with a framework of critical thinking and decision making. And we'll go through the four-step process that is included in that, but really there was it's a way to provide safe, quality care in any setting. And at the same time, to the nutrition care process, ADA, which is now the Academy of Nutrition and Dietetics, developed a standardized terminology that can be used on each step of the nutrition care process. At that time, they had named it the International Dietetics and Nutrition Terminology, and as of 2014, that is called the Nutrition Care Process Terminology, or NCPT. Until this came along, there was no healthcare terminology that adequately described the nutrition conditions which dietitians were responsible for diagnosing and treating. And we now know that every accredited dietetic program are required to use the nutrition care process, including how to write a PES statement, which is the problem, etiologies, signs, and symptoms. So all of these statements and all this process is to be used for critical thinking. And if you think about it, a lot of the training we have provided around how we do counseling doing the full assessment, using critical thinking, using MI to identify ambivalence, using a participant-centered skills. This all comes in line. And in fact, clear back in 2008, the National WIC Association, at the request of our academy, said, how's WIC going to do this? How are we going to integrate the nutrition care plan? And at that time, there was pros and cons identified. We both agreed that nutrition assessment is the first step in the nutrition care process, that we need clear and concise documentation based on accurate assessment. We need standardized definitions. Similar to, we have risk factors, and how do they line up with the diagnoses for medical nutrition disease is used in the PES process and provide structure. They both provide structure. And both at that time, our Oregon WIC lessons, or motivational interviewing, participant-centered services, however you want to call it, all come around VINA. At that time, the value enhanced nutrition assessment is how we renamed it, because it's a mouthful in itself. But both the VINA, or how we do business, and the nutrition care process includes nutritional thinking, critical thinking, to link the assessment with the care plan. So out of this, all these different styles have kind of emerged, and the nutrition care plan is trying to remain flexible to be adapted into different documentation styles. And I've outlined on this slide that narrative, which is just kind of going through, and you just list it all out. And in some ways, you just have to, it just kind of keeps going. It doesn't have a set way. And some of us would like to have open-ended notes field so that we can do that, while others would like to have it a little bit more structured. The subjective, objective assessment and plan, that's what we currently have. And for the most part, that is also present in CQUEST from what I can see so far. It's a much looser process than what we have currently. The problem, intervention, and evaluation, known as PI, is another option. Some of you may be familiar with the assessment, diagnosis, intervention, monitoring, and evaluation. Ilan has already given me the thumbs up. This is what she would advocate for. And then there's electronic records, where that has been a lot of discussion of how much is built in, and we don't have that electronic record capability at this point, similar to what maybe EPIC is in the hospital setting. But our SOAP note can align with the nutrition care process note. And I'd be interested in for those of you that have been trained in one set or another, or that you have interns that you have worked with, what has been your experience with one style or another? For new graduates coming into WIC, has it driven you crazy that we use a SOAP format?
Hey, this is Annie. When I started, I was trained in the ADEM style, and I tried using it for like first couple weeks I was working, and then I quickly adapted to how we do it at WIC, and I find how we do it is much easier than how I was trained. As it's faster.
Oh, it's faster? Okay.
Yeah, because the problem with the ADEM style for me is, for example, the diagnosis. You have to pick from a list of diagnoses, and you have to do it a really specific way. And so sometimes it's like, it just feels really redundant, or like you're not really getting to the point of what you're actually, I don't know. For me, it just felt harder.
Mm-hmm.
And this is Jill. I have to say, I agree with Annie. I came from a state where the dietitians only did the nutrition care process in WIC. And I think one downside is that it's very time consuming. And I know for our agency, we would have to completely redo our schedules to allow more time for the dietitians, because it's a much more involved process. Definitely pros and cons to it. more detailed, more clinical, but just much more time consuming. And I don't think, after using it for many years in the WIC setting, it's designed for a clinical setting. It's not really a community-based system. So the codes that you're using, like Annie was kind of alluding to, you have to adapt those codes to the community setting.
Okay, thank you, Jill. And I see that Valerie made a comment that I feel like we're covering all of the, do I say, Annie, how did you pronounce it, Adamy?
Something like that. Yeah.
It's ADIME.
ADIME, thank you. Okay,
Yeah,
thank you, ADIME. Covering all the ADIME topics in our system, this tends to be a question of organizing the information. I taught ADIME and NCP, and I agree the rigid language needed for NCP makes it clunky for use. Very good information, Valerie. Thank you. Megan said, I was trained in ADIME and found it difficult to transition to SOAP because I had never used it before in WIC. It seems to be a standard for RD programs, so it'd be nice to stay current with the recommendation. Oh, Sue Shi, thank you, Karen, for reminding me. Sue said, she would go with the group. She knows that we need to keep up with the time, but she's old school and prefers the SOAP format for the same reasons, time, and it didn't quite line up, and it felt like you're doing it to just kind of be mimicking clinical and not necessarily WIC. Oh, I missed a comment from Lauren. Oh,
I was going to say there's a couple of comments
thank
previous
you.
to Valerie's.
All right. Oh, geez. Does anybody want to read them for me? I'm having a hard time with my getting back up there.
Sure. Lauren says that she was surprised that we use SOAP since ADIME was drilled into my head in school, but Amber then also agrees with Annie, which I think was to the comment of it being clunky to work with in WIC.
Okay.
Sometimes for fun, when I'm trying to, I don't know, chart differently, I've tried throwing in a PES statement in my chart just to see if I can. But it's kind of, I don't know, it's clunky. Under my assessment.
Uh-huh.
Mm-hmm.
Okay. This is really helpful. And has anyone used PI, which is the Problem Intervention and Evaluation? Okay. So it sounds like ADIME is, go ahead.
I was just going to say that Ricky says we're ahead with PCE, which needs something different than ADIME. And then Richard says he learned both ADIME and SOAP, and none of us like ADIME. And it says, Valerie says ADIME works better in a system like Epic, which has fill in the chart notes. Anyway.
Thank you. Yes, I see it now. And then Ilan said the question is, will AA and will the Academy enforce the use of ADIME so that all charts will be consistent throughout the profession? I really searched for that, and I do need to dive into a 2019 article, Ilan, that from the journal of where we're at with the nutrition care process and using the terminology. It doesn't look like it. I think it was more looking at how we integrate the terminology into EPIC systems, into SNOMED, and kind of aligning it with language that is out there. And SNOMED stands for what, Julie? Do you remember? So I think it is not, from what I could see, Eileen, we did not see that it was a mandated. And I think what we've seen from NWA, because I also went to see if there was a position paper, and this might be a good one for TRA or maybe Laura to take forward of if the nutrition services is requiring it. But it feels like we have flexibility, and it feels like the new programs out there, and Beth, you took a look at the other systems, were they using something other than SOAP formats in their documentation?
Not that I specifically remember, no. I don't remember anything specific to ADIME or these other formats.
Yeah. What everyone has brought up is what I saw in the 2008, and I would love to see an updated discussion from NWA, but they all said that it's very valuable for us to understand the nutrition care process and the PES concept so that we can speak knowledgeably about it, but they did not necessarily see the feasibility of using that documentation given the need for participant-centered services in a prevention-based program. I did post to Basecamp the public health documentation of NCP. So there are some good examples in there so that we could look at that as we start to craft some of our questions. But I think there was kind of the feeling that WIC is ahead of other times with our counseling style, and that rather than force ourselves to adapt to a system that is really grounded in clinical, that we had some flexibility there. But it does bring us to the bottom line. If it's not documented, it didn't happen. And that is what we are seeing in some of the chart reviews. So really our desired outcome is to find a system that meets the needs of you working in the local agency, as well as helping communicate with our staff. Because if we throw acronyms or diagnostic codes at them, there's a whole learning curve and training that would have to go along with that, and also federal guidelines. So we know what the federal guidelines require in terms of that. Is there a complete assessment there? Have we done critical thinking? Have we included the plan and the resolution of decreasing health outcomes associated with the risks, and have referrals and future plans been made? And yes, there is a lot in the nutrition services standards, which I also uploaded to Basecamp as well. Ilon wonders if NWA can help us with statistics on what other WIC programs use. And Karen asks, Autumn, do you see opportunities for billing? There are some correlations made in some of the documents that are out there of how the billing comes along with the go ahead, Jerry.
It's possible. I was going to say, if it's WIC, if it is, you can't bill for anything that would be counted as WIC, though. So
Right.
It really, sometimes it's better to have it very separate, because if it could potentially be WIC, it has to be outside of the scope of WIC to be able to do the billing, because you can't necessarily double charge for that.
Does that mean it also has to be outside of the data system, the WIC data system, or just connect?
I don't, Julie, do you know?
I don't think so. I mean, we take data that comes from other sources, Kim. Bring it over so that we have that, whether it's covered by a clinical dietitian or something like that. So,
yeah, that
there's just very clear. There's just very clear notes. Yeah.
I think maybe I was trying to unmute myself. I'm landing in the middle. Yes, we do get things from other places.
Yeah. Yeah, I think it's whether the services are being paid for WIC services, but we can bring over documentation that we might be doing in a different setting into our charts to help with the continuity of care. So really, some of these questions going forward is, how do we want to be involved as a new data system and documentation elements progress? if we've got, and I heard it, some excellent dietitians trained in ADIME, and we've even have someone who has done training of others in ADIME, do we want to look into that to see if there's any components that we need to think about that are worthwhile? Or do we want to have it be our own system that we we still meet the intent of doing that complete assessment in all the parts of the nutrition care plan process. We do want this group to be involved. And as Kim said, it sounds like we have more time that we can build that in. And I know that when we come out to do a review, there's a lot that we just see a snapshot in time, and it may be artificial. It's based, folks are stressed, but it kind of comes down to like, how do we capture things that might be happening, but if it's not documented, we don't know that it's happening. And ultimately, what we want to have is we want to improve the system and find out how to improve the system to make your work easier, more meaningful, and preserving quality nutrition services. Any thoughts from the state office out to the local agencies or local agencies? Julie?
Cheryl, this is Vernita, and I just wanted to make sure that that we caught Ricky's comment in the chat about...
Oh, could you read it again, please?
We could not make appointments longer in order to accommodate for longer time to chart because there's no funding added to staff for that purpose. So she's advocating for efficiency, I believe. And Greg did a nice summary. He said that he learned SOAP and ADIME in his curriculum. They're both fine, except he did not find PES statements helpful, the PES statements helpful. They're difficult to write because they're so specific, like everyone has said. The SOAP and the ADIME slides that you presented showed that both of those forms of documentation are comparable. So if it's just a different acronym, that's fine, as long as it gives him a framework to make sure that he gets the right types of information in there for future reference. Mm-hmm. So I thought that's kind of a nice summary of what folks have been saying, and I wanted to pass along those two thoughts because we didn't want to miss those. Both are relevant to this discussion.
Mm-hmm. Thank you for that. And I realized as I was writing out the SOAP versus the NCP that where we get stuck sometimes is in the intervention part of it. And I recognize that where the nutrition care process, it clearly defines like the nutrition counseling, the client goal, motivational interviewing, at impacting the diagnosis. And for us, sometimes the plan is just, return back or have the dietitian see, it was fine. But I realized that sometimes our SOAP notes undervalue the importance of really talking about the counseling and nutrition education provided, and kind of where the nutrition care process does that a little bit deeper, because it also involves like the monitoring and evaluation of what's resolved with the signs and symptoms to achieve those goals. So it was a little bit of an interesting aha for me. And if we want to dive deeper in terms of how we're doing this and looking at some common charting to reach a greater consensus, because as it is right now, it's each one of you can deem what's appropriate, and yet it's a mixed messages because we're also reviewing, are they complete? So
Cheryl, can I ask a question?
Yeah.
So this is specific to high risk care plans and so far in both the current system and in what it looks like is going to be for Sequest, it's sort of like there's just one place to document, and that's whether we're in prevention mode and everything is fine and it's a paraprofessional, versus what the dietitian needs for that subset of WIC participants that are needing to have the high-risk care plans. And I guess that's one of the things that, as you were talking, that's the part that stood out to me, is we've sort of made the SOAP note, which everybody can understand and everybody can kind of get. It's sort of been generic, and so it's kind of like trying to figure out that this is this subset, this piece that needs to go further. I know there is some dietitian specific pages or parts in Sequest, but trying to adapt a for everyone section to just for high risk, and how those two go together, I think is an interesting question for us to pose for Sequest.
Mm-hmm. Yeah, and there is an element, and I know we're hitting up the close to the 4:00 time. What Sequest uses, Ilan, is yet to be developed in a lot of ways, because they have relied a lot on questionnaires outside of the system. So that's the work that Vernita will be doing, and that's what we can be circling back around to this group on. Debbie says we need to decide who has access to the high-risk progress notes. Right now, in some states, they lock that down so that not all staff can see the high-risk notes. Ricky says if we're going to use the system for the next 20 years, then an open box, the way Sequest has set it up, can accommodate both a nutrition care process or SOAP and in 10 years, a new one. Thank you for that, Ricky. Mary Kay said, I like having flexibility in charting so that as new systems emerge, we're not stuck in one rigid format. I am also acutely aware of having a very mouse-driven system that requires so many clicks that contributes to repetitive use injuries. I think we need to address incomplete notes through training, not rigid format, which it feels like the Oregon WIC style so far. And he says one thing that might be helpful is having a system in place where it'd be easier to print something that we could send to their other healthcare provider when they request what the nutrition plan is, currently is. Sometimes they ask, and how it is in TWIS right now is really fragmented, not everything in the same spot. Ilan says, my previous interns were very confused and voiced their dislikes for the SOAP format. I can understand why. And then Greg said, is there a way to create request a note template screen that is accessible to RDs to type into, but accessible to all staff to view or read, ditto to Annie's comment. So those are all really good ones, and I'm hoping that Vernita is taking lots of notes here. And I also want to add the cautionary tale that since this is off the shelf, that we are somewhat limited in what we can, how much we can modify the system. It is very open-ended right now, but it is also one that can be exported out. So we might have there might be some interesting projects along with that. And Ricky, Ricky says, and I know we're over time, the Sequest certification history plan is actually exportable and can be sent to the healthcare provider. So it's on the same lines. And Ilan says, thank you for all you do. And back at you all, because you are so essential to the process, and this conversation will continue. And I really appreciate all the feedback that we have heard from you today. So thank you so much. And more to come. Have a great day, and we'll sign off for now. Thank you.
Thank you.
Thank you.
Thank you.